Okay, this video is called, Does a Hysterectomy Make You Stupid? And what this is about is women who get a hysterectomy before the age of 35 have increased risk of dementia. They have increased risk of all kinds of cardiovascular problems, and the most common cause of dementia is actually cardiovascular causes. That stuff about Alzheimer's is bogus. I talk about how bogus Alzheimer's disease is as a diagnosis in my other lectures on dementia. I look at brains all the time. All right. Anyways, with regard to hysterectomy, this is a big study from the Mayo Clinic. This lady who was the lead investigator on this study, they had over 2,094 patients with a hysterectomy, and they found that when women were less than 35 years of age, having a hysterectomy had a 4.6 times increased risk of congestive heart failure. They had about 22 years of follow-up. That's a big increase in risk, 4.6-fold increased risk of CHF, 2.5-fold increased risk of coronary artery disease. Those are massive increases in risk. They had a lot more hypertension, and that's really, I think, the big secret. I'm going to explain why a woman who stops menstruating because of hysterectomy has a lot more hypertension. And I'll show you pictures in a moment, but basically, menstruation is a therapeutic phlebotomy. It lowers their hematocrit, their red blood cell count, as a percentage in the blood. I'll show you the pictures of that in one second. Let me just show you. This is a lady who was a lead investigator. Mayo Clinic doctors in general tend to be really smart. They tend to be about in the top 10% of their class overall, and even higher for the competitive specialties. But I would say that Mayo Clinic is very good at treating conventional disease with conventional methods. They have very good surgical techniques because they do high volume for some of the more uncommon surgeries. So would I say Mayo Clinic might be good to be referred for a complex uncommon surgery? Probably, yeah, because they got a lot of experience in those rare things. Okay, but what do I think else about the Mayo Clinic? I think for a lot of subjects like health and wellness, they're a joke. They still practice conventional medicine. All conventional medicine is based on drugs and surgery for treatment of chronic diseases. And, anybody who's listened to my lectures knows that for most of these chronic diseases, low-fat vegan diet works much better, especially if you started early on. The Dean of Education, Diversity, Equity, and Inclusion. So, what does that mean? And by the way, I'm half Puerto Rican, okay? So what I've noticed is there's almost like favoritism if a person's not as good a student academically. What do I mean by that? I went to University of Illinois for med school. They had a Hispanic Center of Excellence. They will not invite me back because if I help the students do well, then they won't get as much grant money because the students are having problems. It's weird, but I was a phenomenal student, first in the class, 99% boards, but they won't invite me back, and I know why. They'll invite guys that barely graduated, but they won't invite me back because they're intimidated by me. And also, I know lots of doctors. They'll have me take care of their personal problems. They want to ask me about their health problems and their family. They want me to help them figure out what to do with their family members' illnesses, but they won't invite me to speak publicly in front of their group because they don't want all this nutrition stuff, and they don't want me to show how much more I know than them because they know individually, but they don't want it shown. It's kind of weird, but that's true. Medicine is not like sports. In sports, you want the best guy with the best technique, and you want to learn from him, and you want to win. In medicine, it's like you want to go with the status quo. That's where the money is, and that keeps you out of trouble. You go beyond that, you could cause all kinds of problems. You have to work longer hours, not get paid as much, maybe get in trouble with some administrator or something. Hysterectomy, here's another paper, increased risk of dementia, and they said the risk of cognitive impairment was increased when the woman had a hysterectomy alone, even worse if she had oophorectomy, especially bilateral oophorectomy, removal of the ovary, and the risks were increased the younger she was at the time of the surgery. So, like I'm saying, I'll show you why that is. So the bottom line is, yeah, hysterectomy puts a woman at risk for very serious health problems. And I started becoming familiar with this when I look at these brains of demented females between the ages of 50 and 65 years of age. And I'm like, usually when I look at a 50 to 60-year-old female, she's got a clean brain. I don't see any silent strokes or other problems. So if I see strokes, I start thinking, she probably had a problem. Maybe she's a drug addict, okay? But if the lady's not a drug addict, she's demented, she's not an alcoholic, and there's no other obvious cause, I can tell you most of my time when I get patients like that, it's because she had a hysterectomy at a young age. Okay, it's a therapeutic phlebotomy, menstruating every month. It lowers the hematocrit, the number of RBCs in the blood. Thinner blood means less thick blood. Lower blood viscosity, that means lower blood pressure. high blood pressure is #1 risk factor for atherosclerosis and dementia. Overtreatment of hypertension is also a major risk factor for dementia. Red blood cells typically live 120 days. The older they are, the stiffer they are, less flexible for passing through capillaries. And it's probably from glycation. That's thought to be the main mechanism. Normal red blood cells about 7 microns in diameter. Normal capillary about 5 microns. I'll show you pictures of this in just one second. We're just kind of orientating you with these word slide here. Therefore, red blood cells have to bend to go through capillaries. A spleen has even smaller diameter sinusoids to prevent a red blood cell from passing through. These red blood cells are cleared by splenic macrophages. And the point is that a premenopausal woman's got more young RBCs and a lower hematocrit, and that's going to lower her blood pressure, and that really protects her a lot. You almost never hear about a premenopausal female having a myocardial infarction. Okay, so typical RBC about 7 microns, got to go through a 5 micron capillary, so it's going to have to bend once it goes into that capillary. High cholesterol, like high fat, LDL cholesterol, is a bridging molecule. It sticks these red blood cells together. There's a couple other things that do that as well, but LDL cholesterol, that's why it's a big risk factor for coronary artery disease, because it sticks red blood cells together, and then it's harder for them to pass through this capillary because they're like a rouleau means stack of coins in French. Normally red blood cells on their outer surface have a negative charge. That's called a Zeta potential. It's due to what's called sialic acid residues, and they'll have like a lot of sulfates on them. A negative charge they'll have a negative, let's just say they have a negative charge on them. Okay, and the negative charge and then repels the other red blood cells. The LDL cholesterol sticks them together, so the higher LDL, the higher the blood viscosity, the thicker the blood. Other bridging molecules are IgM antibodies, like present with infections, fibrinogen present with acute stress, uric acid present with excessive ingestion of fructose, and with excessive meat ingestion. Okay, so normal blood pressure, let's say down here, something like, 100, 105 over 70 or something. Here's a really high blood pressure, 200 over 100. We talked about the RBCs having to deform themselves to pass through these capillaries. So if they're all stuck together, or if they're stiff and glycated and old, they don't pass through as well. And then if you overtreat high blood pressure, then you chronically underperfuse the brain. This is just a picture from my talk on dementia about the Jack de la Torre theory of mouse equivalence, whereby he would tie off the carotid artery in a mouse and chronically underperfuse that side of the brain. The middle-aged and older mice would be demented typically 2 months later. At autopsy, they would just find an atrophic brain on the same side the carotid was tied off. And then there's a whole bunch of things that essentially do the equivalent, like congestive heart failure. Okay, aortic stenosis, aortic regurg, post-CABG hypotension. There's a whole bunch of stuff. I give you the whole entire lectures on all the stuff. What happens when you eat the high-fat meal? It sticks your red blood cells together, and the pumping pressure has to go up. The thickness of the blood goes up, and also people start getting coronary artery angina-related pain. They've done a study. This guy, Peter Quo, was a cardiologist in Pennsylvania in the 1950s, and he'd feed his coronary artery angina patients a high-fat meal, and they would check their blood lipids every 30 minutes. Right at peak lipemia, they'd have the most symptoms. It's even worse with the vegetable oils. You don't get any of that with a carbohydrate meal. I have a whole bunch of lectures on hypertension and atherosclerosis, but the gist of it is normally when the red blood cells are flowing correctly, you've got a laminar blood flow velocity profile, with the red blood cells in the center going fastest, then the WBCs adjacent, and then the plasma, and that's how it should be. When you got hypertension, you'll have increased blood velocity. It hits the median divider at bifurcations too hard. This will be external carotid, ICA is internal carotid, and then it'll bounce off with turbulent flow as well as retrograde flow, and that confuses the endothelium, which is expecting forward flow, antegrade flow, and it'll start to express prothrombotic molecules. You form a small blood clot on the wall, far wall away from the median divider, and that's the way atherosclerosis starts in the coronaries and in the carotids. And the more hypertension one has, the more one gets this sort of thing. The thicker the blood, the more one gets this sort of thing. So that's why you don't want that. Okay, I separately gave lectures, plenty of them, about the role of sodium in hypertension. It's worth knowing about. Now I'm just going to show you about a brain. This is a brain from an axial section. That's a transverse section from side to side like a loaf of bread. And in this lower part of the brain, this is called the basal ganglia. And the reason I'm showing you this is stroke land, high blood pressure. So when the pressure is really high, Very common to get strokes in here. I mean, as a neuroradiologist, I see these things every day. Multiple strokes in this area. Okay, but here, I'm going to show you on the next slide why it's this big screw job. If the pressure's too high, the pressure coming off at a real high pressure, there's like a shear velocity that'll injure these arteries, and you get what's called lacunar infarctions in the basal ganglia. But there's hypotension when the pressure is too low, like overtreating hypertension, then you don't perfuse the deep white matter adequately, and that is the land of watershed infarcts. What I'm saying is overtreated hypertension will tend to make this area ischemic, where I put the skull and crossbones. You can ask any neuroradiologist. We see tons. I could see thousands in a given day of silent strokes in this area. So that's a dangerous business. Carotid artery stenosis can drop pressure to this segment. Overtreating hypertension can drop segment to this flow to this segment. The smart move is control your pressure by eating a good diet, getting your sleep, and getting your exercise. That's the smart move, okay? Or at least optimize it as well as you can. And be careful. I'd be more afraid of overtreating hypertension than undertreating it. Dr. McDougall has good lectures on hypertension. Oh, is that all right? Oh, I guess that's my last slide. So the bottom line was the woman has increased risk because a lot of women, they're not afraid of hypertension and atherosclerosis. I've had nurses, ICU nurses, really good nurses, come up to me. They're almost 50 years of age, and they go, well, my cholesterol's 300. Is that bad? Like they think it's a big joke. And the reason is a guy gets scared if he has a brain in his head around 40 because he sees other guys becoming impotent or having myocardial infarctions and problems like that. Versus a woman, none of her premenopausal girlfriends have had any atherosclerotic problems. So when she gets a hysterectomy, let's say between the ages of 28 to 35 years of age, she's not aware that she just had a massive increase in risk. She becomes like a man in terms of not having that monthly therapeutic phlebotomy. So they often continue to eat really lousy diets, and so they can be quite severely hypertensive and asymptomatic until they have a stroke. So getting a hysterectomy at a young age is much more dangerous than one thinks. So the smartest thing is to avoid all these estrogenic chemicals. I've given a bunch of lectures on that, and it's really worth knowing about.